Sitting at the edge of West Texas lies a beacon of hope, as the largest transnational city of El Paso is pushing the limits of frontier surgery on complex cranial and facial deformities. Among them, the most common condition, which is craniosynostosis.
Craniosynostosis is a condition that affects infants and newborns. When we're born, the skull, instead of being one single plate, is made up of multiple separate plates. These plates are joined together by seams, and as the brain grows over the next several years, the seams expand, and as they expand, new bone gets added and more new skull grows along with the brain. In the case of craniosynostosis, the suture of an infant thinks that the patient is 18 years old and it closes prematurely. But what happens is that over the ensuing weeks and months and years, the brain continues to grow. Consequently, a number of changes develop, a number of problems happen to the child, a number of deformities occur, which leads to the need for treating this problem.
At El Paso Children's Hospital in Texas, they are led by Dr. David Yates in the treatment of complex cranial and facial deformities. This multidisciplinary team is nationally recognized by the ACPA and consists of medical doctors, surgeons, nurses, physical therapists, case managers, and more, all dedicated to saving the lives of every single child that steps into the El Paso Children's Hospital facility.
One thing that is unique with these kids is that the face is the first thing anybody sees. So not only do they have the breathing problems, the feeding problems, the problems just chewing their food. This kid can't chew his food. I mean, you can imagine if he tries to bite into a hamburger, it just all slides out. So not only do they have these functional deformities, but they also have very, very deforming facial appearances. And obviously this can really affect the child's psychological development as well as how they view themselves.
My name is Jenna Lowell. This is my daughter, Daphne. When she was born, we found out that she actually had a couple of issues. Her jaw was very small, was very recessed. She had problems sucking, swallowing, coughing, gagging, the whole thing. She was pretty much on oxygen almost 24/7. Dr. Yates decided to see her and he was like, oh yeah, we can fix this, no problem. He decided to move it 2 centimeters forward just in case. And once that happened, everything kind of just clicked for her. So I just, I'm so thankful every day that we decided to go through with it.
Under Dr. Yates' leadership, the Cranial and Facial Clinic comprehensively treats the most complex cranial facial deformities. This clinic allows all the experts to be here at one time for our patients and truly provide convenience of care.
I think what differentiates our hospitals from other hospitals who treat these disorders is, number one, our multi-specialty approach. It's a team approach. Number two, we use the most advanced technology in the care for these kids, whether it be from the surgical planning stages to the actual surgery itself. And three, our team is incredibly collaborative. And it's made up of multiple specialists, and not only just specialists, but specialists who are renowned in this country for what they do and in the world. And Dr. Jimenez is world-renowned for his invention of the endoscopic minimally invasive craniosynostosis technique, which has radically changed the way this surgery is done around the world.
We're at El Paso Children's Hospital to understand their revolutionary approach to treating cranial synostosis with minimally invasive techniques that provide comfort to parents and hope and healing for their children.
The cool thing about the endoscopic craniosynostosis surgery is that it can be done very rapidly and very effectively. So instead of the child being in the operating room for hours and hours, the average time is around 55 minutes or so. The baby stays in overnight and gets discharged the following day. After surgery, they get scanned for a special helmet. This helmet helps guide the brain in the direction that we want. Baby wears the helmet 23 hours a day. Babies get used to the helmet. To them, it's like having a onesie on or socks. They don't even tell that they have it on. And then once they reach a certain age, we stop with the helmet therapy.
A child is the greatest gift a parent can ever receive. The staff and physicians see each patient as family. Being at the frontier of medical advancements allows EPCH to continue to become an epicenter for the future of cranial and facial deformity surgeries.